first one is the infection rate. Now we found about 10% of children in our COVID patient. Yeah. So it's similar to other countries around the world. Yeah. And it's the proportional is similar to the age group. Yeah. Okay. About what's different between the severity of COVID in children and adults is have much less symptoms and much less severity. And about 20 to 30% of children have no symptom at all. What we found is from the contact investigation that one of the family member already has COVID, and we do the PCR test. We found that about 20% of the children who tested positive has no symptom at all. It's not certain yet why the children have less symptoms, but there may be about multifactorial reason. Like for the first one, they think that the children have already exposed to many respiratory viruses in the first maybe 5 to 10 years of their life, and they already has the immunity that's maybe cross protection with COVID. And also most of the children have less underlying disease like heart disease, lung disease, or obesity. So they are more healthy and they have the more stronger immunity. From my experience, most of the children who has the symptoms have less symptoms, like more like common cold, fever, runny nose, cough, and the symptoms last only for a week or two. Some of the cases have pneumonia, but much less percentage that need oxygenation or ventilator. And we found that the mortality rate across the world is very low, much around 0.1%. About the complication in children, there's a complication that distinguished from other adult complication, which is because MIS-C. It's like an inflammatory process that we found it in our adolescent, around 10 to 13 years old. It's starting around 4 to 6 weeks after the infection. It's the cause is it's like the overstimulation of the immunity in our body and cause failure in many systems in the body, like the cardiovascular system, the GI system, and also the lungs, the respiratory system. But the incidence is only 1 in 100,000 cases. So it's still quite rare. But now in Thailand, there are around 5 to 6 cases. We found about 100,000 of cases of children right now. For that complication, it's still quite rare and still treatable. In children, the mode of transmission is still the same. It's mostly droplet transmission, you cough, sneezing. In children, especially in small children, it's quite difficult to control their behavior. Especially the one younger than 2 years old, they could not wear masks. And even the one older, you could not have them wearing masks all 24/7. It's quite difficult. And when they're yelling, screaming, coughing, sneezing, they're not covering their mouth and they're running around. So I think the contagiousness is maybe a little bit more than infected adult. But in other factors, like the children may have less symptoms, so they have less cough. And so the spreading through the cough may be a little bit less. So actually a symptomatic person can spread the virus, but usually less than symptomatic one. Because if you have less symptoms and no cough, you're generating much less droplets. We found that some of children have very high viral load but no symptoms. Yeah, so it's possible that one person have a lot of viral load but not much symptoms, especially in children.